Good evening. My name is Donna Thompson. I'm President and CEO of Habilitative Systems, Inc. And we just wanted to welcome you to our inaugural Race and Health Equity Board reception. First, but it won't be the last. Thank you all so much for coming out. And I've been saying increasingly that this is about legacy. You know, it's our time now. It's our moment in history to continue to struggle, to continue to pass the torch to the next generation and make sure that we leave our mark on humanity. But we got some folks in this room, ladies and gentlemen, who are history makers. That's right, history makers. Our governor released over $100 million in funding to promote something called healthcare transformation within the state of Illinois. And members of those collaboratives are present here this evening. People who have been leading the charge around race and health equities professionally for 3-4 decades are here tonight and will be honored tonight. Let me just keep moving the program forward. And it is indeed my pleasure to introduce to you at this time the chair of HSI's board. Ladies and gentlemen, please recognize our board chair, Mr. Mel Brooks.
I want to thank the staff at HSI. You know, those folks who are really in the trenches, I want to thank them because they provide such a critical service. And that service became even more important during this pandemic. HSI, Don and his staff, they amaze me because they continue to provide these vital services even during the most difficult times.
At this time, I'd like to bring up our chairperson of the HSI Fundraising Committee, Ms. Cynthia Washington, please.
We need to give this thing a title that really helps people understand what it is we want to celebrate tonight, and that's how we came up with the issue of race as well as health equity. I tell people all the time, I said, this issue of health equities and inequities, disparities, this is our civil rights movement. I will move into making our first presentation of our first honoree, Mr. Herbie Buchanan Jr. He is the Regional Operating Officer for Amita Health.
I want to acknowledge this organization, first of all, for the services you provide to the community. It's an impressive list of services. It's filling a gap that's left by many other healthcare organizations, including those of us who are in the hospital and ambulatory business. And so I want to applaud you for that. It means a lot to be recognized because it just raises the profile and lets the community know that we're interested and that we're doing things, that there's action, not just conversation and planning, but action. So it means a lot. And the more we're recognized, the more people are talking about it, two things happen. The community gets involved and we're held accountable as well.
I will now take the moment to move to the next honoree, and that is Dr. Helen Davis Gardner.
I would just like to say thank you so much, HSI, Donald Dew, Mel Brooks, Cynthia Washington, and the other board members present. It has been my honor to serve on the board for more than 20 years because I see the value in what HSI accomplishes.
As a psychiatrist, first of all, many of us are afraid to come and seek help. Many of us are told, oh, just suck it up. But I want people to know if they need help, that we are here, HSI. As a psychiatrist, I'm here. We're here to help you. We're here to treat you. Whatever you need, you do not have to suffer in silence.
It is truly our pleasure to acknowledge also this evening Mrs. Kimberly Mccullough Starks.
Just so you know, there is no greater award than this, and that is because I know personally of the work that HSI does, and I love the title of this. It's Race and Equity. I feel like I'm at the BET Awards. I feel like this is Oscars for me, and I say that because I know the work that this organization does, Daryl. I know, how hard the employees work. I know how engaged the board of directors, is, and for them to recognize me for the time that I've spent supporting organizations such as this, it means everything.
Our last honoree this evening, sister who I have had the privilege of getting to know this year in a really special way, Mrs. Donna Thompson.
Historically, someone like me would go and meet with CEOs. And historically, they would try and fan me off to that community person. But this sister said, no, let's talk business. That's right. If you can't speak to me and see the worth of what we're bringing to the table, because all of our patients have worth. So let's really talk business. Well, first, I'd like to acknowledge HSI for having the vision to really have their first inaugural award. But it really means a culmination of the work we've been doing in Chicago to really reverse the shameful legacy of the disparities that we're seeing in so many of our communities. You know, I think the COVID-19 pandemic really put a spotlight on, you know, we've got two pandemics going on. One, the shameful disparities of healthcare, and then two, how the COVID-19 pandemic has really accentuated that.
How can you not be inspired, you know, by the power in this room? Not only with our awardees that have been recognized here this evening, but so many of our colleagues are here. We've got Deborah Vines in the room from The Answer. We've got Dr. Vessel from I Am Able. We've got Dr. Rashad Safir from Bobby Wright Comprehensive Behavioral Health Center. We've got David Berkey in here from the Illinois Health Practice Alliance. We've got all these great powerhouses in the room. We've got corporate partners, and many of them are the sponsors here this evening. You know, it makes a difference when we come together. Collaboration is key. Somebody even said that friendship is essential to the soul.